After those really interesting breakout sessions, I managed to join each one of them and just to hear a little bit about what was happening, and really interesting. So this morning we are joined by Maeve Nivinon, Amanda Banda, Greg Harrison, Margaret Fitzgerald, and Dr. Yosef Mamo will join us shortly as well. And we're going to hear from each of them about what they heard and what they took away from the breakout sessions. So we had 4 breakout sessions. We had one that was on advocacy and resourcing. We had one that was on beyond COVID lessons for health system strengthening. We had the third one, which was responding to COVID, which was around knowledge exchange. And then the 4th one, which was around compassion, particularly for healthcare workers and among healthcare workers. So Amanda, I might start with you. And just to introduce you, Amanda Banda is a global health advocate in East and Southern African region for WAMUS. I hope I'm saying that correctly. I saw the presentation myself of WAMUS and its great advocacy this morning. So Amanda, what did you take away from the session on advocacy and resourcing? And we're going to have just about 5 minutes for each of you, and then we can go back and forth. Thanks, Amanda.
Thank you so much, Nadine, and welcome back to everybody that is following this live stream. We had a very interesting session on advocacy, and I think maybe broadly the top lines for me is that there is at the moment, I think, existing advocacy opportunities. It's the ripe time, and opportunities abound to do advocacy as individuals, and think that Dr. Saleha's presentation earlier in plenary, for those of you that attended, is a typical example of what an individual person can do, but also organizations can work together with other organizations in solidarity, in partnership, to push forward a lot of things. At the same time, on the resourcing aspect, I think that the issue of the financing is critical, and that yes, there are the options that we are very familiar with and that we know of, that we often tap into when it comes to resourcing health in general, and even the COVID response, but we are missing out maybe on other alternatives. And so I will start maybe on that point, on the key takeaways in terms of beyond the taxation, beyond the efficiency, the aid and grant, what else are we missing out? Because I think it was clear in the presentation that perhaps that's not enough. The issue of health is a human right, and that it needs to remain at the core of the resourcing agenda for COVID and for health in general also strongly came out. And the core for us as advocates to really ensure that our governments, we use our voices to push our governments to do enough to utilize and explore aggressively, that was the word, all possible options to ensure that we have enough resources. And so 3 things: elimination of financial flows, a lot of resources untapped there that are not being utilized, or that channel is not being tapped into enough to ensure that we have enough resources. So there was a presentation on the huge amounts of losses of finances through illicit financial flows, debt management, as well as an issue. A lot of countries are spending more on servicing debt than they are doing on health. And so can we speak about restructuring debt, and as well as increased aid transfers, the potential that exists and what is happening is also not matching, and therefore there is abundant opportunities for advocacy there. And so briefly on vaccine availability, the issue that we were challenged and asked was that if we think that 20% vaccine availability would be unacceptable in high income countries, what do we think? Why would we think that this should be acceptable in low income countries? And so it was a challenge and a call to solidarity and coordination and alignment, and just getting together, that there is something that we can all do from this presentation, that we need to call our governments to move from the donation charity based kind of thinking to solidarity and partnerships, and stop holding these vaccines, and ensure that we have access to everybody, especially also the healthcare workers. And a lot of practical examples there on how VEMOS has also done a lot of advocacy around the setup, and clear examples given. I think a lot of letters and things that they have done shared. I think that from the audience, one of the questions was, what can countries that are yet to reach this level of, vaccines have not yet arrived, we don't even know where they will come from, we don't even know how, what can we do? And so there was a lot of initiatives going on. I think a lot of you have heard about the TRIPS waiver. I think pushing your governments to push to support for that is an opportunity. The issue of also pushing your government also to support the CTAP initiative, I think, is also an opportunity, but also on an individual level, but also working in coalition with other civil society organizations, with other NGOs that are doing this, to plug in and support that work as individuals, as organizations. I think ActionAid PSI and other organizations also recently launched a campaign to vaccinate healthcare workers globally because of the worrying number of deaths. So that's roughly the brief takeaway from our session. Thank you so much.
Thank you, Amanda. Very, very well covered. And I know from some of the presentations I saw, for those who weren't able to attend those breakout groups, make sure you go and catch the recording of those sessions and the presentations and resources that were shared there. Really, really valuable. So thanks, Amanda. We'll come back to you on that. And maybe moving over to you, Greg. So Greg Harrison is the coordinator of the Gulu Sheffield Mental Health Partnership. And I know Gulu was a lot of talk around Gulu in that session as well. Greg, your session looked at pandemic preparedness and health systems strengthening. So I just wonder if you could feed back a little bit, what were the learning points from the pandemic about the state of health and well-being globally? And I guess, what is needed to build back better with stronger, more resilient health systems? Over to you, Greg.
Sure, yeah. I think one of the challenges in lockdown everywhere has been to challenge the established routes of learning. I think we've all slipped into, haven't we? And it's not a bad thing, but we've all slipped into people in partnerships, a very central element of the partnership work is that we go out to Uganda or Zambia or wherever. And I think for me, one of the really good things that's come from this that definitely came out in the presentations is that maybe we don't need to do that as much. And sometimes maybe, I think, although nobody actually said this, listening carefully to what was being said is that sense that this is an opportunity to think, okay, as people were saying, the technical solutions like we're doing now are great and they're really useful, but actually they can never take the place entirely of the face-to-face. That so much of learning, so much of the challenges, so much of global health systems is actually pretty old-fashioned, is about the face-to-face. It's about the building relationships, the trust, the respect, and everything else. And when you've got those established, these Zoom calls and WhatsApps that people were talking about are incredibly useful, but actually they are built on a foundation of the face-to-face. So those two the kind of twin themes of learning, of the establishing the relationships and the understanding and the respect that enables the learning, and then using the technology more. Certainly, we've been, like everybody, we've had to use WhatsApp calls a lot more, and I think we've really been very surprised at how it's really effective. So what everybody was saying was that the UK partnerships have had to have a much less involving approach. And actually that has been extremely good. And that has resulted in a lot more learning within countries and between countries, which is, of course, what we want, isn't it? And I think listening intently to people, it was really interesting how everybody was just slightly surprised at how something that we never wanted has resulted in something that we did want, and how to channel, when I can say it, how to channel that opportunity and that learning into something better. There was also a little bit of talk about the comparison between the treatment of some health staff in the UK, which we heard in one of the presentations initially. For some staff has been very poor, and for some staff in Uganda particularly, they've been subject to stigma. And so I think there's an opportunity there to think about, okay, so what can we learn? What can we learn together, really? I think in Uganda particularly, and obviously I know more about that, the Ugandan health system experience of Ebola is fairly significant. So they were able to move into a plan, really. And there's been a lot of talk in this country, hasn't there, about our lack of plan. So again, whether we want to learn it or not, I'm not sure, but I think that sense of that the learning that we could take from other countries who have experienced a pandemic and what they did, and it seemed to work.
Yeah.
So I guess for me, those were the main themes, really.
Yeah. Learning.
Yeah, basically.
Yeah.
And all of that learning results in a global health system that is stronger. Right.
Great. Well captured, Greg. Thank you for that. So let's come over to, we were talking about partnerships. So Maeve Nivinon is a consultant obstetrician and gynecologist in Mayo General University Hospital and has been involved in partnerships for many years, particularly with Kenya. Maeve, thank you for stepping in just to give us some feedback, as we had some technical difficulties with Margaret a little earlier on. If you could just tell us a little bit, you were in a session where there were a number of case studies about how partnership responded to COVID-19. They were really interesting. What were some of the key lessons? How did they adapt and innovate practically, theoretically? Yeah, what did you get from that, Maeve?
So thank you, Nadine. Yes, the 3 case studies were very exciting. So from infection prevention control in Timor-Leste to diagnostic lab pivot in Ethiopia, and to continuing to run a pediatric cancer service in Tanzania. There were some key takeaways that particularly reassured us, as Greg has mentioned, that in established partnerships, there is the readiness, whether we are consciously aware of it or not, there is the readiness to scale up. There is the readiness to think about replacement and innovation on a low-tech level to make things happen. And there is the readiness to commit to continuing to run services, even though the external environment is more challenging. And so the typical exchange programs switched to virtual exchange. And yes, while face-to-face brings its benefits, of course, virtual brings many benefits as well. And the key takeaway from the Timor-Leste group was that ability to constantly readjust. So being aware of what twinning activities are there, what twinning tools are there, but instead of thinking of the whole bundle of twinning and quality improvement, actually focusing on the action steps, so where the immediate attention needs to be. And so I think the perspective changed very, very quickly by the need to focus and concentrate due to COVID. So the background tools that are available, once the partners are aware of them, they're ready then to share those tools and use them and switch to implementation much quicker than they might have in the normal course of priorities. In the diagnostic lab services, there is the transferable skills, obviously, of moving from chronic disease programs to acute disease programs, and similar knowledge, attitude, behavior issues, and stigmatization issues that, that unified the three case studies at different times in their partnership. But COVID brought that additional stigma of the partners that may not be indigenous to the community, may be perceived with stigma because of foreign travel or foreign exposure. And so it reminds some of us of the previous stigma in different pandemics, particularly back to the HIV pandemic. The quick reactivity, the quick reactions that the partners could provide was unifying as well. The work that had been ongoing was ready to pivot quickly. And what was quite amazing from these three partnerships is the ability to continue complex research, to continue complex development of their services, like to change a lab to being able to switch up to PCR for a community of 10 million very quickly, to change pediatric oncology to electronic records in the middle of a pandemic, to scale up horizontally to spread the infection prevention control that was initially only used in 3 facilities. It's quite remarkable from these 3 case studies. And then the question, the unifying question at the end in terms of, was there a power shift? How did it happen? Did it happen? What was the learning from that? Perhaps I get the impression that maybe there isn't a power shift because the power was already where it needed to be. Perhaps I could say that we see the gaps, we fix them anyway, is the takeaway on that element of these 3 particular case studies. And that's from 3 very, very active and focused partnerships that already are very well established. So I took away the message that if the partners they are able, they are willing, then they can take action. And they just said, we got it.
Yeah, thank you, Maeve. And I know just from being in that session, you know, I was able to see some of the presentations, and really the innovations are quite amazing. It's really, really worth, again, going back, watching that recording, looking at those slides, and learning so that we can learn across all partnerships what's actually possible. So thank you for that, Maeve. Yosef, lovely to have you here, and thank you for joining us. Dr. Yosef Mamo is a medical doctor from Addis Ababa, and he was in the session on compassion. So such an interesting session, such a wonderful concept, and you know, wonderful to give that attention to compassion. It was a closed session with healthcare workers. So Joseph, we'd love to hear, you know, what did you learn from the reflection of the healthcare workers, you know, how they've reflected on the role of compassion in their own lives and in their institutions? What were the highlights? Over to you, Dr. Yosef.
Thank you, Nadine. So some of the things that I would like to highlight is, for example, somebody said compassion means, you know, appreciating someone else's suffering, you know, being empathic, going into the shoes of another person. Compassion is about dependability. There are some small, what appears sometimes for each of us, very small talk, like, you know, what can I do for you? How can I help? From a colleague, these are very powerful words. When we say it ourselves to others, we feel helpless and we feel we are not doing well, but these are very powerful things. Dependability, covering for your colleagues' shortcomings and reaching in the weak areas. Not minimizing somebody's suffering. Sometimes when we try to reassure people, we try to simplify, but that's not a very good way. But to appreciate the situation that our colleague or patients or caregivers are in is very important. Kindness in various ways. And there are a lot of ways of kindness. As human beings, we cannot, you know, I cannot list them all, but sharing what scares each of us, you know, what is scary to someone. It may be different. So sharing this, whatever is scaring our colleague, whatever is scaring me, sharing to others is really practicing compassion. Also, we can change systems. Some systems appear to be very, very sterile from compassion. And one of our colleagues mentioned how this so-called sterile field, like infection prevention, could be made, compassionate. How we can incorporate compassion into whatever we do. Though sometimes it may look irrelevant in that specific area. Somebody said, health workers at this moment are like soldiers who are putting their lives in line to save others. And during this time, some have experienced abuse. They have experienced sexism, they have experienced racism. And the most important thing is when others stand beside this stuff. It was really very helpful when they stood beside this and said, we will care for you, we will do everything, and we have put our lives in line, but you cannot abuse us. And standing like that with colleagues has been very helpful. So kindness in various ways, listening, taking time to visit or call, and generally, whatever you want others to do to you, you should also do it to others, the golden rule. So that is what we shared in our group. Thank you, Nadine.
Thank you, Dr. Youssef. Just really practical and human, human sharing, the human underneath everything that we've all been dealing with this past year. Margaret, I wonder, Margaret Fitzgerald, thanks for joining us. Margaret is a public health specialist in the Irish health system. Margaret, I wonder if you just, as you listened to the feedback from those breakout sessions, if you have any thoughts yourself to share.
Well, thank you very much, and thanks to all the other speakers. And it has been a year like no other, and we're in public health, we're aware of how the pandemic has shone a spotlight on some of the really amazing things that have happened and some of the real challenges we have faced. And partnerships is being so important to how we do things. Even here in our own country, partnerships is hugely important in my work, because I work mainly with the marginalized and with the disenfranchised, and a lot of our work is done through partnership with NGOs and with communities. And I think looking at the experiences of some of the partnerships, even that we support through the Esther program here in Ireland, how they have doing things differently and doing things more efficiently has been a real interest. And also bringing it back to the core aims of partnerships, which is putting the focus on learning and sharing that learning. And I think what we found is remote access can work, although I had my own glitches this morning. That, and the solidarity. So that's also part of the compassion that Dr. Youssef has talked about. The solidarity with partners, and even in some situations, have been able to reassure partners, we are with you. We have not forgotten you, and we will be there with you, even though it's different. And particularly with the rollout of vaccine, and that comes from the sharing that we already had before the pandemic, and it's just stronger. The other thing is the empowerment of communities. So I would have worked in the Ebola outbreak in 2014 in Liberia, and in the end it was the community that delivered the response. And no pandemic, we shouldn't waste any opportunity. So, as Tedros, Dr. Tedros, WHO said, outbreaks are inevitable, epidemics are not, and Mike Ryan as well. We should keep learning as we're doing, and strengthening the health service. is so important, and that's what a lot of the partnerships have been looking at: stronger services, whether it's limiting face-to-face but then strengthening referral pathways, or you know, getting communities, getting essential drugs out has been really fantastic, you know. So that maybe you do less of some things and more of other things, and I think that's probably enough for me for the moment.
Okay, thank you, Margaret. I see Marion has joined us there. Marion, just in our last few moments, I know you were instrumental in the compassion session. Is there anything you'd like to add in terms of what you took away? And I just ask you to be very brief, and thank you for that.
Thank you. What we recognised is how hard it is to create a safe space to show and share compassion. But without starting to show and share that amongst colleagues, we're not going to be able to survive the next year. So there's something about being present with our colleagues and recognising our own worth and what we've actually achieved is the hardest thing to do. But is absolutely necessary.
Thank you, Marion. Very powerful words, also spoken from you as a nurse, as a system leader, and as an educator. So, so thank you for that, Marion. So I wonder, as we kind of draw this session to a close, rather than me summarising, I would love to come back to each of you very briefly and just ask you for just a final message. What, at the moment, what is your message that you would give to everybody listening in the conference, everyone who's tuned in today? This is the International Year of the Health and Care Worker. What is your message coming from where you are coming from? So I'd love to start with you, Amanda. What's one message you'd love to give?
Thank you so much, Nadine. So I think it's join movements in country, in the region, and I think also globally, and make a case to WHO and partners in the global north to remove the barriers I think that are being faced at the moment. IP, I think it's tech transfer and decentralize manufacturing of vaccines. And also, if your country is one of those blocking the TRIPS waiver, I think push hard that they should remove it. I think Dr. Celaya gave us a practical example of what you can also do on a personal level. Thank you so much.
Good, and thank you for being a great example of advocacy. You get a space and you take it for your advocacy message. So thank you for that, Amanda. Greg, as brief as you can, please. Just one short, simple, final message for everybody. And you're muted. Still muted.
Sorry.
Go.
Sorry. That's it. Let's use the opportunities that have emerged for better ways to learn and to increase the effectiveness of our partnerships.
Thank you. Very succinct and well said. Thank you, Greg. Maeve, the last word from you. What's your message for us today?
Thank you. For all of us in partnerships, let's continue to be aware of the gaps. When we see those gaps, let's encourage the leaders to lead well. Let's build the capacity of everybody on the ground so that we can all be prepared to act.
Thank you for that, Maeve. Dr. Youssef.
Thank you, Nadine. Now, compassion, being compassionate and compassion is a neglected area and probably a missed opportunity to enrich our practices. This is, it not only does it improve the quality of life of our patients, but also several studies in HIV and palliative care have shown that even survival of patients can improve. But not only that, but the caretakers also decreases depression and mental illness and burnout. So I think there is a modeling at the bedside manner, but I think we should give it more time, structured trainings, people, because, medicine and nursing in general cannot be divorced from compassion, but we try to divorce it because of the development of, natural science in it and biomedical sciences. But I think this is an important thing that we learn when we are faced particularly with such kind of problem as COVID.
Thank you, Dr. Youssef. Compassion, compassion, compassion. We can take that into any stream, into any place, into our homes, into our work. So thank you for that. And we're going to leave it there now just because we're out of time with this session. So thank you to those who gave us feedback, and thank you for the respondents, and back to the platform for the next sessions for the rest of the day. So thank you, everybody. See you soon.
Thank you, Nadine.
Bye-bye.
Bye.
See you.